What type of healthcare practitioners are best suited to start up a cash-based medical practice? Well, I get this question quite a bit. Can a neurologist start a med spa? Can a emergency room doctor start up a direct pay practice? What it comes down to, I think, is, obviously there are certain individuals that are, or certain specialties that are going to be more likely to start up some type of practice. Someone who's not been involved in primary care is probably not going to start up a direct care practice. And of course, there are some ramifications, there are some obstacles that you'll need to do before you can actually start that. But in terms of, what type of doctor is best suited for it, I think primary care doctors who have seen lots of different things and are willing to explore and learn and study and to go into those different types of practices, if they want to do aesthetics, and they're willing to take the time to go through the training, then I don't think there's nothing wrong with them starting a med spa. I think a better question to ask is what type of individual should be able to start up a cash-based medical practice. Obviously, someone who feels that they are entrepreneurial, they're able to be risk averse, they're able to approach challenges and be willing to overcome those challenges. They have to be willing to be flexible and pivot, especially when it comes time to starting up a practice and perhaps you don't have all your eggs in one basket in terms of financial, and you need to decide what should you be doing in terms of what should be risking in terms of growing your practice and investing in different trainings and investing in your staff, investing into different equipment. As I've said before, entrepreneurship is not for the faint of heart, but if you're willing to do this, there is benefits down the road in terms of becoming your own boss, becoming financially free that I would never take back again. But again, I'm wired differently than most others, I think. It's not for everybody, but for those who have done it, I often ask them if they would, if they could change some things, if they could, decide to continue what they were doing. Most said they were willing to, go out, put themselves out on a limb and willing to embrace those challenges and embrace those difficulties, because it's so much sweeter at the end when you're able to overcome all those different things.